The most recent one I can remember is we had an autistic boy come in that had to have a stress test done. And we didn't know at the time that he was autistic or he was coming in, and his mother had made a book explaining everything that had to be done. And you had to file the book, and you couldn't change any of the pathway of the book and what you were doing and what you were saying. So we got through it with him, and then afterwards we got a really nice letter from her, and she'd sent a letter to the board and the president saying what a good job we did. So that was nice, getting recognition for that.
The most memorable, I guess, case or patient experience was patient that we had on Christmas Eve that came in with chest pain and was having a big heart attack and really looked very sick. And we did sort of the standard therapy and took him to the cath lab and fixed. He had a blocked up artery that we fixed, and he left the hospital in great shape, and to this day says that he was reborn on Christmas. We'll never really forget that case, yeah.
Well, I think the most, we were just outside talking, the most interesting, memorable cases that we have are, from my standpoint, interventional cardiology is, the helping patients, especially young and old. We were just talking about some of the youngest people we've seen with heart attacks and, able to save their lives. So, it's always exciting to do that, to really change somebody's life, like that.
Well, every day is a memorable experience, but there's a lot of patients that we see here who have interesting stories, and it's always rewarding when you can do significant changes in people's lives. And I think I have a lot of patients who I think I've made a significant impact on. In terms of personal things that have happened here, I think that we have a great team of physicians and made some great friends since I've been here. So I've been very happy here, and there's been lots of stories, not one really to pinpoint down, but a lot of things going back.
Probably some of the most interesting memories I have so far are actually running into people that can be connected to my childhood or to my past, and these are both employees of the Sherman Healthcare system, some of which I went to high school with, or some of whom I went to high school with, as well as patients who are oftentimes family members of either people that I grew up with or people that I somehow knew as a kid. Those have probably been the most remarkable or interesting memories. Of course, there are many patient care situations that stick out, probably too many to go into detail, and I certainly wouldn't want to break any privacy laws.
I have lots of stories. I don't know if I, should tell all of them here. But generally, I appreciate collegiality of the work here and the support between ourselves that we give, not only within, which is natural within the one group, but between all colleagues here. So the overall working experience at the institution is very good, and patients mix is very interesting, and you tend to have a chance to meet interesting people. And I really like the nursing staff support when I start to work. That's what kind of impressed me initially when I was starting to work in Sherman, knowing many hospitals. As a fellow resident, you moonlight in multiple places. So I very enjoy this environment. My memorable experience was my initial introduction to this whole institution. When I joined the group, they were doing like the variety show at the Sherman Hospital. So when I came, I started like beginning of August, and there's like 2 weeks since I started, and my partners told me, oh, we have to go to practice line dancing. And so I had to go to do line dancing and get some, cowboy dress and all this stuff. And we had the show that was going on. It was mostly done by Sherman staff, and most of the audience, fortunately, were Sherman people too. So it was done in Elgin. So it was pretty funny. The first thing on the job I had to learn was the line dancing.
There's been many wonderful experiences. 2 experiences come to mind. One is February of 2001. My son was actually born here at Sherman Hospital, and we had no idea that there was going to be any kind of complications, but as soon as he was born, he started turning blue, and they diagnosed him with a congenital heart defect. When he got transferred to Loyola, just a few hours after he was born, the staff at Loyola said it was because of the Sherman Hospital's quick response and quick diagnosis to our son's congenital heart defect that he had such positive outcomes. And now he'll be celebrating his 10th birthday next month. So that's a wonderful, wonderful personal and professional story that I have for Sherman Hospital. The other thing that comes to mind is March 2008. We actually opened a new heart failure recovery center, which is a heart failure clinic here at Sherman. It was started by a large team of people who worked for about a year to get the program up and running. And then I was able to be a part of that team and help get the program off the ground, and worked there for over 2.5 years. And so now the program's up and running and has some great outcomes, and we're very proud of it.
Definitely, I think the whole Sherman is about the family, about the workers that you work with. Yeah, especially in the departments that I am in now. I've known those nurses for all the years that I've been here. They are part of what makes Sherman what it is. The care that we give, and the patients that we meet along the way truly are remarkable people that tell their stories, and we're able to tell stories as well.
I would say over the course of the 17 years, I've always done some type of cardiac care. So I have a lot of history with certain patients. There are patients that I took care of up in critical care when they had their open heart surgery, 15 years ago, that I still get to see here every year when they come in for their stress tests. So it's kind of nice that, you took care of someone during such a critical time in their life, and now you get to see them every year, doing well and thriving and, just being healthy, which is really great. And I would say here at Sherman, especially the people that I work with now, we work with a great group of people, and lots of great friends here in the unit, and that makes coming to work a good experience.
There's good experiences, bad experiences. I think for the most part, the experiences that I remember most are the times that I was able to just to touch somebody's heart in a way. Maybe they're just going through a really bad time in life and with their health, and me just kind of comforting them or letting them feel like it might be okay, or they're not the only ones going through this hard time. You can always tell when they just come out feeling better a little bit.